Hi everyone, this is me just checking in. Yesterday was my third week after surgery on my aorta valve, which I had replaced with a mechanical valve, open heart surgery. How am I doing? Yeah, still in a lot of discomfort as everything's still healing, knitting back together again. Still uncomfy sleeping and things like that. But what's happening? Well, they're still trying to level out my warfarin level. They need to get my blood to a level of 2.5 to 3 anticoagulant level. So that means it's 2.5 to 3 times longer that it takes for my blood to coagulate, to clot, so that my blood runs freely over the new valve that I have, and it sort of washes it, keep it free of any blood clots or anything like that. So we're still trying to get to that level. So I'm having a blood test twice a week, so that's not very pleasant, you know. There is a machine, but for some reason my GP doesn't have one of them, so it's the old-fashioned needle in the arm job. Anyway, so that's that. The scar is looking good. I've had the dressing, it's now been off for a wee while. I'll give you a quick peek. So turn away if you're a bit squeamish, but I'll see if you can see it in this light. Don't know if you can or not, but there we go. That's what my scar looks like. That's the two. There they are, two drainage holes, and it goes right up to my collarbone. That's a little bit of a lump up there, so it's like the cut into my collarbone. So it's still all quite sore, but it is all knitting together nicely. None of it's coming apart or weeping or anything like that. So that's certainly what we wanted. Fitness, well, fitness is actually coming on very well. As you may know, I did a lot of walking before I went in for my operation, so my physiotherapist says just get yourself out there, get pushing yourself again, start aiming up for your 8 to 10 miles a day. Obviously that isn't going to happen overnight, but she says go out, push yourself, but then you really must rest when you get back. So I was thinking that when you come out of hospital, you have a thing. It talks about having 3 minutes walk a day and all this sort of rubbish. But that must be for, obviously everyone's an individual. Everyone's at a different fitness level. So for me, it's a bit different. So I started off doing a mile. I've done 2 miles. Then I did 3 miles for a couple of days. Then I did 4 miles for 3 days. Yesterday I did 2 miles. I wasn't feeling overly great, so I didn't push it too much. Today, feeling tip-top, did 6 miles today, which was really good, all the way along the beach. Saw 4 seals, which was brilliant, so it just helps keep you going. But feeling really well. The heart valve seems to be working very well indeed. And I've got certainly no problem with my legs. It's a different story if I need to do a bit more active with my upper body. That can be quite exhausting because everything's still knitting back together and resettling itself. So that's a bit different when I want to do something upper body. Obviously, cannot lift anything heavy, so I stay away from anything like that just at the moment. So that's where I am. I'm supposed to be getting entered into a rehab, a cardio rehab scheme type thing, so hopefully they'll show me what I can do weight wise, you know, keep my chest muscles and my body muscles up and running the best that they can. So that's where we're at the moment. Nothing else to report, so I'm really glad my fitness is going well, but every now and again you know, it all hurts a lot when certain breathing and certain straightening up. You need to straighten up quite often, otherwise you're going to end up being bent over. The most comfy position is obviously curled over. Everything's no stress on anything, but you don't want to end up being like that, so you have to expand yourself a little bit. Keep breathing in nice and deep, which can sometimes be a little bit painful, but I'm on the mend. It's only week 3 as well, so really looking forward to seeing what I can excuse me, sorry, it's getting late. Seeing what I can do when I'm fully recovered, and I'll keep you posted. So thanks for watching, and see you soon.